You're watching the world's best medical media, the MDTV network. It's MGPO Tonight, where our investigative teams work 25/8 to make sure you know all you need to know about the MGPO.
Hi, I'm Malika Marshall.
And I'm Tom Lynch.
Tonight, we're going to fill you in on the crucial role the MGPO plays in advocating for physicians, improving the quality of care, and promoting excellence in the clinical, academic, and research arenas.
We'll also show you how the MGPO's comprehensive back office services pay off for physicians. And we'll see what the MGPO envisions for our future.
And we'll also take a peek at MDTV's all-time top 10 medical records. I guarantee some big surprises when we unveil those. But first things first, Tom?
Malika, it's time to clear up some confusion once and for all. What exactly does MGPO stand for? We conducted our own roving camera survey, and here are some of the answers we got.
MGPO, isn't that the stuff in Chinese food? Gives you a headache? Yeah.
MGPO? That's what I've got for 7 across.
MGPO Midco.
Well, everyone ought to know that the MGPO is a lovely little British sports car, and unfortunately lacked brakes, so it was only good for going and not for stopping. I owned one in my youth. It got me quite interested in emergency medicine.
I Googled MGPO and got 9,263,823 entries. The top one is the Mountain and Glacier Protection Organization of Pakistan. Would you like to hear the others?
Thanks, John, but we'll take a rain check for now. It's obvious there's some confusion out there, so let's turn to some experts to help clear the air.
Happily, everyone knows that the MGPO stands for the Massachusetts General Physicians Organization. It is the largest, most distinguished and successful multi-specialty group practice in New England, made up of 1,700 physicians who practice medicine at the MGH.
We're a physician-led organization. Our mission is to be a powerful advocate for physicians and patients. Our goals are to support clinical excellence and to improve the work life of physicians.
So, now you know what MGPO really stands for and why it exists.
But how does the MGPO accomplish its mission? Let's take a closer look at one area that benefits physician practices every day in several ways: administrative support. In its first decade, the MGPO has built an efficient and lean administrative structure that's quickly becoming a national model.
Streamlining administrative processes and ensuring that physicians are compensated for what they do are the cornerstones of our work every day. Our goal is to get it right the first time and maximize the time physicians have to spend with their patients. It's a tall order. We process 130,000 claims each month and have reduced our days in accounts receivable from 120 to 43.
In 10 years, the MGPO has accomplished quite a bit. Here's Dan Ginsberg, MGPO President and COO.
We want to be the group practice where the most talented physicians in the world want to take care of patients, teach, and do research. Our current priorities are: 1, making physician compensation more competitive. And to accomplish this, we're focusing on advocacy, contracting, and billing. Number 2, leading the nation in healthcare quality and safety. 3, developing an appropriate growth plan in partnership with the hospital. And 4, improving the working lives of our physicians.
So, if taking care of business means creating a solid administrative structure so doctors have the support they need to focus on clinical care, then the MGPO is well on the way.
Next, Tom shows us how quality and safety are just as important to the MGPO as financial performance.
Introducing Placebex.
It cured my arthritis.
When I need to stay awake, I can count on Placebex.
It saved our relationship.
Medical professionals have recognized the powerful placebo effect for decades. Now you and your family can harness its power to treat your ailments.
I'm hoping it will cure my BlackBerry addiction.
Ask your doctor about Placebex. She may not believe in it, but that may not matter, as long as you do.
My golf game just keeps getting better and better ever since I started using Placebex.
Try Placebex, because who knows, it just might work. Most side effects may be imaginary. Prescription not required, but may improve results. Not recommended for patients sensitive to sugar.
Later tonight, see the healthcare celebs as they arrive in their finest and stroll the red carpet to attend the prestigious McGovern Awards. That's next, following MGPO Tonight.
At the MGPO, quality and safety are as important as financial performance. MGH and its physicians are among the top performers in the nation, and on every credible quality performance measure, the best in Massachusetts. Even so, the MGPO is committed to continuously improving the systems and processes of care. It's a leadership frame of mind that's patient-centered and physician-driven.
When it comes to quality, our focus is trying to coordinate the care of our sickest patients and taking the best practices from across our hospital and across our physicians' offices and making sure that every patient at MGH receives that level of care.
When physicians are actively engaged in the quality improvement process, the goal is always better patient care without undue administrative burden. The work we did this year on radiology prior approval is a perfect example. We ended up with a process that yields useful information while potentially reducing the burden on physicians.
Although achieving excellent performance by today's measures is a worthy goal, the MGPO looks far beyond that.
We are by no means standing still, and we need to move quickly. We're national leaders, and the MGH should be ahead of the pack on both quality and safety. We have an obligation to move the nation forward, and we will.
Now that's the kind of pioneering approach that MGH is renowned for. MGH physicians were the first to demonstrate the use of ether as an anesthetic. They've been world leaders in the treatment of burn patients since the 1940s, and they've led the nation in advancing medical imaging technologies. Today, MGH physicians carry on the tradition of bringing revolutionary innovations to patient care with such advances as telemedicine for treatment of stroke patients.
Can you say hello?
Hello.
Good. Can you say?
Proton beam technology for treating pediatric cancer patients, and with the operating room of the future, ushering in the next generation of surgical environments. Those are just a few MGPO physician initiatives that are already improving patient care and physician work life. A promising work in progress is the re-engineering of ambulatory care.
We haven't changed how we practice medicine in the ambulatory setting in over 50 years. In the meantime, the world around us has changed dramatically. So we're going to take this opportunity to design a new way of practicing medicine. The MGPO, CIMMYT, and the Stoeckel Center are working together to redesign the ambulatory practice. We're going to integrate the needs of the provider, the patient, and their families with current and future technologies into a new way of practice. This is going to benefit all of us.
Next up, we'll see how the MGPO advocates for physicians and patients.
We'll peer into the MGPO's crystal ball to see what's in store for the future.
And we'll take an exclusive sneak peek at those all-time top 10 medical records.
Later this week on MDTV, don't miss MGPO, Billing Compliance Unit. A special repeat airing of the famous Audit, What Audit episode, starring J.L. Heffernan as Nate Numbers McGee. Then, don't miss an all-new episode of the medical reality show everyone is talking about, Mission Physician. Will Team A finally pull ahead? So far, they're racking up points nailing down the items on their scavenger list. A mummy, an empty parking space, a dermatology appointment. Meanwhile, the other Team A remains mired in a deadlock.
We're not going to leave the premises until the vote on where to begin searching is unanimous.
So typical. Time's running out. Could the moment of truth be at hand? Find out on the next all-new Mission Physician.
Ever since the beginning, the MGPO has been a strong advocate for educating all the stakeholders about what is needed to ensure outstanding health care. That includes educating payers, government policymakers, and the public. One early and continuing MGPO responsibility is contracting. Ann Dubitsky has the inside story.
Contracting is our bread and butter. It's complicated and challenging, but together we have made great progress.
For the MGPO, advocacy also means delivering care to all patients, regardless of their ability to pay. Last year, for example, unreimbursed and under-reimbursed care provided by MGPO physicians to 27,000 patients totaled close to $20 million. Mayor Tom Menino recognizes well the MGPO's contribution to a healthier Boston.
MGH physicians are such an important part of the fabric of the Boston community. I appreciate all they do. They even got along with their colleagues at the Brigham, which I think is great.
Public officials are key shapers of healthcare policy, and the MGPO is committed to keeping them educated and informed, and to vigorously advocating policies that promote outstanding care.
Legislators and all citizens are always on the lookout for guidance, instruction, and practical advice whenever they face a healthcare challenge. I get all of that and a lot more from the MGPO.
When it comes to health policy here in the Commonwealth of Massachusetts, I don't make any decision until I have a discussion with Torch and Dr. Slavin. We're truly partners in that endeavor.
The MGH is, and always has been, an invaluable resource for healthcare policymakers. I know I can count on MGH physicians for creative, practical solutions to very complex issues.
The bottom line is that the MGPO gives its clinicians a strong voice at the negotiating table, in the political process, and in the public forum. Malika?
Well, Tom, the MGPO has achieved much to be proud of in 10 years, but what about the future? We asked David Torchiana for his perspective.
I'd say that if over the next 10 years we can continue to make progress on contracting and compensation, establish ourselves as an authority on patient quality and safety, and begin to integrate the advances in genetics and informatics that have so much promise, if we can do all that and improve physician work life, I'll be satisfied.
If past success indicates future accomplishment, the MGPO is well poised to set new standards for efficiency, growth, quality, and safety improvement, a supportive work environment, and ongoing delivery of the best clinical care in the world. So congratulations to the MGPO on 10 years of outstanding achievement and best wishes for continued success.
Now it's time for our exclusive sneak preview of MDTV's all-time top 10 medical records.
Well, you know, Tom, it's no secret that talent runs deep at MGH, even showbiz talent. You're a perfect example of that. What's not common knowledge is that practically every medical specialty has its own musical group.
That's right. And they've all made recordings of their favorite tunes. And that's what this list of medical records is all about.
Okay, here we go. Here's number 10. From the Dermatology Service, the Skin Tones, and their big hit, I've Got You Under My Skin.
I've got you under my skin.
In the number 9 slot, from the Sleep Disorders Program, The Z's, and Last Night I Didn't Get to Sleep at All.
Last night I didn't get to sleep.
Number 8 is The Birds and the Bees by OB and the GYNs.
Let me tell you about the birds.
Number 7 is by the Ultrasounds of the Radiology Department. I Can See Clearly Now.
I can see clearly now the rain.
From Cardiac Surgery, the Defibrillators, and top medical record number 6, How Can You Mend a Broken Heart?
Can you mend a broken heart?
From the Neurology Service, number 5, Dizzy by the Neuro Bureau.
The number 4 spot goes to You're So Vain by Plastique from the Division of Plastic Surgery and Reconstruction.
Number 3 is by the Psychiatry Department's group, Time's Up, for their rendition of Feelings.
We actually have a tie for the number 2 spot from the Weight Center Ounce of Prevention's favorite hit, He Ain't Heavy, He's My Brother.
He ain't heavy.
And by Gastro and the Enterologist. Yummy, 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 I've got love in my tummy.
Yummy, 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 I got love in my tummy.
And the top spot of the MDTV's all-time top 10 medical records goes to the Department of Urology, the Broken Stones with You've Lost That Lovin' Feeling.
Well, unfortunately, we're out of time. Congratulations to all 11 top 10 groups, and congratulations again to the MGPO for a great first decade.
Enjoy the rest of your evening.
Good night.